Hi folks, Jess and Al from the Psych Collective and the Heroic Collective now. I do a lot of work with people with PTSD and I want to have a little chat about what I call the 3 states of being in PTSD. It's something that I see over and over again with my PTSD patients, and it borrows from something called the threat drive soothe model, but I think we've improved upon it a bit. So let's have a look. Now, the predicament in PTSD is that we're often stuck in this overwhelmed mode. Okay, it's kind of where people are almost all of the time. What do I mean by that? They're fatigued, their concentration is hopeless, they've got no motivation and they don't enjoy stuff. Yep, they're sensitive, irritable, distressed. They might be doing or saying things they regret in the context of relationships, which is getting them into trouble. They're in a kind of victim mindset. You know, it's someone else's fault. It shouldn't be like this. It's all unfair.
Why did this happen to me?
All that kind of stuff. They might be numbing themselves out with alcohol. Things feel futile, time slipping away, and you feel like you're failing. So it's a hopeless situation to be in, really. Now, the thing is, when you're in this predicament, if all you know is work harder, try harder, guess what?
Fix the problem.
Yeah, people just get more and more fatigued.
Yeah.
Okay, and all of this stuff gets worse and worse over time unless you do something sort of a bit more proactive. And that's not necessarily medications, right?
Yeah.
Okay, all right. So what could you do? So what I advocate is you move from the sort of overwhelm mode and you deliberately move into a recharge mode where you charge your batteries up. Okay, now people who have a high work ethic, who are very conscientious, they don't like doing this.
No, and if they're coming from kind of occupational trauma sort of background, they don't know how to do this.
Absolutely.
Their training has told them, this is a waste of time, just go and fix the problem.
Yep. Yeah, absolutely. So what does recharging your batteries look like? And it's essential, right? So it's you've got that mobile phone analogy that I really like. Okay?
Yeah, talking about like at the end of the day, you plug your phone in to charge its battery. You don't even question it, right?
Yeah.
You know that you use your phone during the day. You know it's going to drain your battery. You don't tell it it's use and it's weak and it's worthless because it hasn't worked hard enough.
Why aren't you self-recharging?
Yes, yes.
Yeah.
Right? You plug your phone in at the end of the day, you don't even question it.
Yeah.
Yet when it comes to recharging us and kind of whatever our version of plugging in at the end of the day looks like, it comes with this layer of judgment of, I shouldn't have to do it, I'm weak for doing it, it's a waste of time.
Yeah.
There's other things I should be doing instead.
And look, it might be the case that you barely needed to do this before you had PTSD. Well, that was great, but guess what? Things are different now.
Yeah.
Okay. So what does deliberately recharging yourself look like? Well, sleep, obviously. Okay. Now, that's a whole complicated discussion, and you can have a look at our videos like the 3 sleep levers. That's a whole thing. Other than sleep, self-soothing, just time in a quiet space. You know, like loud kids often drive people with PTSD crazy. Yep. So, and similarly, high chaos drives people crazy. So low chaos, orderly situations, appropriate exercise. Now, what I mean by that is if you smash yourself to pieces with exercise because if you're exercising, that's exercising, well, you're just going to be more fatigued for your trouble, okay? Art and music, for some people, a hobby. Easy wins. Easy wins is good. So easy wins is just doing the little things that kind of make you feel better. You know, you might have some little tasks, you know, that you need just to finalise that are sort of occupying your mental RAM. No. Smash those easy wins out of the way.
Go for the low-hanging fruit.
Yeah, exactly. Okay, so easy wins. This is where supportive therapy also can help recharge. It's kind of like flushing all the mental chaos. You talk to the therapist, you make sense of it all. So it's not chaos up here. Now it's articulated, it's made sense of, and perhaps you've got some strategies with what to do going forwards. Similar thing if you maybe don't have access to therapy, or as a bonus to a way of decluttering your mind is something called the 4 buckets technique. Again, we've got a video that goes into some detail
and a handout you
about
can download on that one.
Yeah.
As a psychologist treating patients with PTSD, whether I'm using an EMDR approach or like a heavy schema therapy approach, if it's more kind of complex childhood trauma, I will not proceed with trauma processing therapy until my patients can do that.
Yeah. So it's a critical skill. Like you can't.
Absolutely.
Yeah.
Well, there's multiple skills in that.
Yeah,
That's the problem.
yeah.
Like this can actually take a bit of time to learn.
Yeah. And developing a willingness to do it as well.
Yes.
Yeah. And it's worth actually having a chat if you're in a situation where your spouse is like, oh, geez, we just lying on the lounge all the time. Well, if you're lying on the lounge, you know, gaming or something, that's not so great. But if you're charging your batteries somehow, not necessarily lying on the lounge, it's helpful to have that discussion with your partner.
Oh, show them this video.
Yeah, that's what we're doing, right? But you don't just recharge for the sake of recharging. Okay, well, you can, by all means do, but we're actually doing it so we can do stuff that we need to do. So in PTSD, that might be trauma therapy. Okay, so we're doing it so we can do the hard stuff. So what I'm calling heroic mode. So overwhelm mode, recharge mode, heroic mode. Okay, so heroic mode might be the work of treatment or learning and applying distress skills. Okay, this is really difficult. When you're first diagnosed with PTSD, that feels insurmountable. It just takes a lot of work, a lot of recharge to get there. Heroic mode might be just staying calm with your family, you know, not losing it.
Yeah.
Okay, so you might also want to have a look at the distress cycle. That's another series of videos that we've got. We've actually got a course called Surviving Distress, all about how you can not basically become lost and possessed in the anger state and do and say things that you regret. So it's to save your relationship. So that's massive. The trauma work itself, just doing the stuff that needs to be done, keeping up some sort of routine and keeping your chaos in some sense of order. That's all kind of heroic. And if you overdo that, guess what's going to happen?
Yeah.
Back up, here you go. Okay. So, you know, it takes some fine tuning to kind of get good at this, but it would be ideal. It would be ideal if you acted heroically until you were, before you became overwhelmed, and then you bloop, come over here, charge your batteries up. Once your batteries are charged up, you come back here. Now, that would be nice and maybe a fantasy to live your life between these two modes. You are going to flip into overwhelm mode from time. It's just the way it is. Everyone does.
That's just life.
Yeah,
but
everyone
it then
does.
comes down, okay, once you've realised you're up here, notice it, catch it, bring yourself over here and back to there. I think people kind of think that they
can
go back
push
and
themselves
forth.
down. Yeah, we're
try.
missing like a hairpin arrow here where you go down and bounce back up.
They try, it doesn't work. You've actually got, this is your pathway.
Yeah, 100%. So, and just the other, I guess the final point on that, staying in here reduces your resilience.
Yeah.
Okay, it's kind of resilience toxic, if you like. Charging your batteries up can increase your resilience, and certainly doing the skills work will as well.
Yeah.
Okay, so what we're trying to say here is this is necessary. This is not some luxury or bludging around. This is absolutely crucial if you've got PTSD, if you want to actually get out of that.